So I started the business in September 2010. I graduated from the University of Hertfordshire with a BSc Honours in Sports Therapy in 2009. I became a sports therapist because I got inspired. At 14 years old, I had a significant knee injury playing netball, and I went to see a local sports therapist in Epping, and he was amazing. So I went to sixth form, did the right A-levels, and went to university, and then I started the business from my mum and dad's house. We had a spare room. I moved the client base into a clinic in Epping, and then in March 2016, I opened a clinic full-time in Loughton. Last year we were very lucky. A client of ours put our name forward at Harlow Rugby Club. They were looking for a new sports therapist, and in July 2018 we started our second clinic at Harlow Rugby Club. So we currently have 2 full-time clinics open 6 days a week, and a third pop-up clinic that we're using on an ad hoc basis in Chingford at the very well established 40-year-old Chingford osteopathy practice. We started that last August. We also have a contract with Harlow Rugby Club. We look after the senior first team, men's team, on a Tuesday night, Thursday night for training days, and a Saturday for match home and away games. Currently, there are 4 members of SB Sports Therapy, who've all been to university to study a 3-year or 4-year degree in sports therapy. We also have a team of virtual receptionists answering the phone 6 days a week. We have a fantastic PA and webmaster as well. And that is our fantastic Stephen's expertise on Tuesday. Stephen came to our Harlow Rugby Club clinic on Tuesday, and for a good couple of hours really helped us to bring out the best of us. So what is a sports therapist? I think most of us know pretty much what a physiotherapist is, an osteopath, a chiropractor. Sports therapy is quite an ambiguous word, and I think some people maybe think that it's a massage therapist or somebody that goes into the gym and maybe helps to strength train. A sports therapist is an expert in assessing, diagnosing and treating muscle, joint, bone or nerve pain. A consultation will consist of a working diagnosis followed by a treatment plan. So somebody would come to see us with a pain. We would have a chat with them, a thorough chat with them. So we would discuss where their pain is, how long they've had that pain, why they think that pain's occurred. And we will ask them about their previous history. Have they had any accidents in the past or any surgery that they've undergone? We will then go through a thorough, detailed examination. So if it's a sporting injury, for example, a rugby injury, or they're a kayaker or they're a golfer, prior to that appointment, we might ask them to bring in or email us a video of their technique so we can get an idea as to how they're swinging the golf club, or if they're a javelin thrower or if they're a netballer. If they're a runner, we'll normally go outside and we will assess them walking and then jogging for a couple of minutes so we can get an idea as to how they're moving, what type of runner they are, if the way that they're running is creating some of their symptoms. Then in our clinic room, we will go through a thorough examination where we'll ask them to do some more movements, either standing, lying. Then we might ask them to lie on our couch. We'll do some more movements with them to find out what's going on with their limbs, with their joints, with their range of motion, with their strength. We will then devise a treatment plan. That will normally consist of a combination of a few things. It will consist of a manual treatment plan, i.e. some soft tissue, some hands-on work, maybe some acupuncture or dry needling, and maybe some sports taping or strapping to a specific joint or a specific muscle, and then also some rehabilitation exercises. So a lot of the times we really try and empower our clients to help themselves and to get themselves better. In a lovely world, we would lie on a couch and somebody prod and poke us, and might fall asleep for 5 or 10 minutes, get up and then back to work or back to life. But in the grand scheme of things, a lot of the way that we heal ourselves is actually by putting in the hard work ourselves. So we really try and empower our clients to help themselves with that. We'll go through some thorough rehabilitation exercises. We'll write them down on an email. We'll take some videos or photos for them. If we're treating adolescents, their mum and dad will be with them in the clinic room. So they are there to help with the child's treatment plan when they're at home. So these are some of the techniques that you might see us using, some manual hands-on techniques and some soft tissue work, some taping and strapping, and also some acupuncture. So who do we help? We help people with acute or chronic long-term pain. Acute pain might be a sprained ankle. They might have hurt themselves yesterday walking along Epping High Street. Or they might have chronic long-term pain. They might have been suffering from long-term back pain for 5 or 10 years. We help sports people and non-sports people. Non-sports people can include people that don't play sport. They have just become a new mummy, they're breastfeeding, they've got back pain. And there might be a farrier and repetitive injury from treating the horses 5-6 days a week. And there might be a painter and decorator and leaning over for the last 10-20 years. They might have had a car accident or a work accident. Or they might have a disease. They might have been born with a scoliosis in their spine where it's got an S-shaped curve in their back, or something called hypermobility where their joints are very, very mobile and more susceptible to injury. How can we help you? I think one of our USPs at SV Sports Therapy is we really do listen. We really do care about our clients. Our first appointment with yourselves is an hour long. So we really do take our time to try and get as much information from you as possible. So we really take on board everything that has happened to you in the past and that could give us some more clues as to why you're in this current pain. We assess thoroughly. Again, we're with you for an hour, so we try not to rush the assessment and really go through the assessment properly. If you've got a knee pain, we don't just solely look at your knee pain. We'll look at your hip, your lower back, your ankle, ask you some more questions as well. And again, we try to educate and empower you to take control and to learn to help yourself. Very proud to announce that we are an official London Marathon Clinic, the only London Marathon Clinic in Essex in 2020 for the 7th consecutive year. What that means is in 2013, the London Marathon Company came to interview me to see if we were knowledgeable enough to identify running injuries and treat running injuries. We were, and we have a contract with them, an annual contract. So in October, marathon runners that have signed up for the ballot, nearly 500,000 across the world have signed up for the ballot for 2020. In October, they'll get a congratulations or a commiserations magazine through their door, and that will either tell them if they're in the marathon for next year or if they haven't got into the marathon. We are in that magazine. We're also on their website throughout the whole year. Beautiful Abby, she walked London this year. After sustaining some significant injuries, and it was a real pleasure to help her. And we really do care about our clients to the point that we go down to the London Marathon every year and stand at mile 25 and cheer them on. And this year we had 54 clients that all successfully completed the London Marathon. These are some of our clients. So that was last year's clients, and then we had some of our clients from the previous year. We also support some fantastic local charity events. We were at Brentwood Half Marathon this year, so we offer pre and post treatment before and after the half marathon. 100% of donations go to the 3 local charities that are associated to the Brentwood Half Marathon. That was my team working with me on the day. We also have an SV events team, as well as having 4 full-time therapists in our clinic. And that was us at the Hatfield Broadoak 10K in May. Again, we offer our services free of charge for the race day, offering pre and post treatment, where 100% of donations will go to the charity. So somebody would want to come and have a calf massage with us afterwards, they might donate £5 or £10, and that will go 100% to the charities. We also support other local events, the nuclear races in Brentwood. We've been part of their races since 2011. They have an event in May, September and November, hence the Christmas hats. We're a little bit early for that one. And there was an event last Saturday that we were at between 7:30 in the morning and 9 p.m. at night. We've been a huge supporter of St Francis Hospice since 2013, St Clair's Hospice since 2013, where we go to their hospice between December and April, looking after their London Marathon and Brighton Marathon runners. And I attempted to run the London Marathon this year for St Clare's Hospice, running over 500 miles before my knee gave way. And that was the start, or the inaugural meeting of the Haven 100 Club. I think that was in November last year, so we are a huge supporter of 3 local charities. We have a fantastic newsletter that is released once a month. It gives our clients some information about what's going on, what events we're taking part of or supporting, some free information about how to help yourselves with some articles about neck pain or back pain or knee pain, some stretches. And that is released to just over 2,000 subscribers. We also have a fantastic website that gives you more information about our company and how we can help yourselves and your friends and family. So what's next for SV Sports Therapy? Currently myself and Annabelle, we are undergoing an extensive course of APPI. They are a world leader in mat Pilates. So you have to have a health science degree to embark on the APPI Pilates courses. Our next course is next weekend in London. There are 3 sections of the course, and then you undergo a clinical exam, and then you pass, and then we can start to educate our clients with more clinical Pilates exercises. Clinical Pilates is a posh word for rehab Pilates or exercise-based Pilates. And thank you very much for your time, and this is one of my things I try to empower myself once a day, and 2 weeks ago that was my sunrise view from my hotel. Sophie Vowden from SV Sports Therapy. Thank you.
Sorry, question please. Do you treat plantar fasciitis?
Yes, I do treat plantar fasciitis.
You have a success rate with that?
Yes, it's often something that's come about over a period of time, and it will often take quite a while to be resolved because it's your foot, and it's often caused by other things that's happening. So it's not just a case of treating the plantar fascia, you've got to look around that area. But yes, we do treat plantar fasciitis.
Any other question? 2 more questions. David?
Sophie, who's your ideal customer and how can I help introduce them to you?
Thank you, that's a great question. My ideal customer is someone suffering from muscle, joint, bone or nerve pain, and they want to get better. They're fed up. They're fed up of their pain. They might have tried a few other things that's not working, and now they're willing to try and help themselves and want to get out of that pain. And it can be from an adolescent's age up to 70, 80. I think my current client is 84 years old, and he used to represent judo for Team GB.
Thank you.